into your new roles as nurses, one of the most powerful tools you will carry is empathy. Empathy is very important. We call upon you to always be mindful of the fact that our patients come from diverse backgrounds and different races, languages, and cultural customs. We will be treating people who are coming to us who have different religious beliefs. We must respect that. It might not be the same as yours. You don't have to agree with it, but we have a responsibility of respecting it. It is therefore our duty to ensure that these differences do not become barriers to care. Instead, we must let them enrich the compassion and understanding that we bring to every interaction between ourselves and patients. Let us do our utmost to ensure that we speak to our patients in a language and manner that will help them understand the importance of disease prevention, regular testing, and adherence to treatment. Let us speak to them in a manner that will ensure that they always understand their ailments, diagnosis, prognosis, and medicinal dosage. Singagcini ngokuthi isingisi nje kuphela. If sibona ukuthi patient esikhuluma nayo ayisizwa, it does not reduce you when you go back to MEC and speak in a language that they understand. Because the intention here is that a patient must understand what you are saying. So if you just speak in a language that the patient doesn't understand, it defeats the purpose of you being there and trying to help the patient, because they are not going to understand the first thing that you said, and therefore they will not be able to take the treatment as it has been indicated.